The RPA understood that improving care is not easy. There is a history that advancements in medical care require a lot of time to be incorporated into actual practice. This isn't because physicians don't want to do it, it's because we have established patterns and practices of care that are required if we're going to just get through the day and see all the patients and take care of all the needs. So if you're going to incorporate something new into practice, what you have to do is create a new process and then have that work in the context of all the other processes that are required for an actual practice or an office practice or hospital practice, whatever you happen to be doing. So what we decided that needed to be done if we were going to really facilitate improved care is that pre-work that's necessary in order to have that advancement or better or best practice incorporated into care would be done by a separate group, the work group, to look at what would it require to incorporate these best practices into care, what tools would be required, what processes would be required, what changes, what would be helpful, what would actually be the things that you would need, all the little steps that are required in order to have that happen. We did all of that. We pulled it together, refined it, and have created the tools that we know work because we've tried them in actual practice. When you receive the RPA Advanced CKD Patient Management Toolkit, it's a big thing. It's a big package, and I understand that it can be overwhelming. So we've gone to some effort to make it easy to get into it and use it in a way that will be most helpful. This is one of the things that we understood whenever we set out to help and facilitate improvement in care. And that is that all of the aspects of this, even to the point of how the kit is developed, how it's organized, what comes first, what comes after that, what comes after that, all of those things are important with respect to eliminating barriers to improvement in care. So right off the bat we understood that when somebody opens it up, the first thing that they see ought to be the thing that would be of most help to them. And so what we have, of course, is an introduction. And that introduction, very briefly, indicates why it's important to improve care for this group of patients, patients who are in the advanced stages of chronic kidney disease but not requiring dialysis yet. It goes into the fact that when you incorporate changes based on best practices, that those interventions make a difference in the care of those patients and in their ultimate outcomes. And then it goes on very quickly to explain how you can take those best practices and incorporate them into your practice. So we outline for the practitioner very simply and quickly how to get right into it. And the first step actually is to understand, why should I do this? And is it going to be burdensome to do it? Am I going to have to take all day just to read through this stuff, to understand where to begin? And the answer to that is no. We've gone to efforts to make this work so that in the first 5 or 10 minutes that somebody opens the kit, they're ready to start using it. There's a guide to the tool choices. Now, why would there be a guide to the tool choices? Well, one of the things that we understood when we researched the whole area of practice improvement, which in and of itself is a science, what we found was that one size doesn't fit all. There's different practice setups, there's different partnership arrangements, there's different everything. So what I'm saying is that they're all unique. And we understood as a result that one kit and one approach was not going to be very helpful. It might help only a fraction of that whole group. And so what we determined to do early on was to have something that could be tailored to the individual practice. And so with that choice of tools, with that guide, what we have gone through is the logic of how do you tell with your own individual practice which tools are going to be most likely to help you improve care. And so that's right at the beginning of the kit. For example, if somebody is interested in determining how their practice is performing in a certain way or in a certain area, let's say blood pressure control, well, then the reader is immediately taken to the place in the kit, the page number, where they can identify how to assess how they're doing with that. Very quickly again, we've developed a tool that will give you a very quick assessment of your practice, and something that can actually be done not necessarily by the physician or even the physician extender, but even an office staff person can go through and do the assessment very quickly. Then with that assessment in hand, knowing how you're doing, then again you're taken very quickly with a page number to an algorithm, to an approach that you can follow then to improve. And once you've done that, there is another tool to evaluate how you've done, whether you've actually improved care. Once you do that, then you have in place the tools to continue to have that change, let's say following that algorithm, as part of your practice. Part of the tools involved are all of those things that you need. So nothing is left to chance. Nothing is left out. There are no pieces that say, okay, I understand now that I need to improve blood pressure control. What do I do next? There's nothing like that left to chance, because all of the what do you do next questions have already been asked and answered. And tools have been developed to overcome all of those potential barriers. And they're just laid out for whoever wants to pursue that avenue. So if that's the avenue you want to go in, then you can go there, and you may decide that that's all you want out of the kit. But if you also want to look at other areas or goals of care, then they're all there that are appropriate and necessary for optimal care of this patient population.